Hi, I'm Dr. Sarah Wasserbauer. Here's the question. Are you ready? Scarring from microblading removal. Would a hair transplantation be possible? Well, we're reporting here from my home office, so pardon the echo. But if you're somebody who's at home and is kind of isolated and has had microblading and is doing nothing better than, staring at yourself in the mirror quite often, which you're not going to do unless you're at home, and you see that there's some scarring when you've removed the tattooing from microblading, because that's what microblading really is. It's a very deep, very kind of scar-inducing procedure that is basically tattooing, scarification, ritual tattooing, all very similar. If you have this kind of scarring, and some people might be more prone than others depending on their skin type, if you have this kind of scarring, it's a good question whether or not that will cause a surgery to replace your eyebrows, eyebrow transplantation, to work well or not. So we have several cases of this. Probably within the next 5 to 10 years, there's going to be a huge explosion because microblading always changes color. Remember, in tattooing, temporary is not temporary and permanent is not permanent. So since microblading is essentially tattooing, these things will fade, they will blend out, they'll kind of blotch out over time. They'll never look as good as you do it the first time. And so over time, you might get some scarring in these areas. Now, once you remove the tattooing, the tattoo laser, remember the hair in these areas and these areas and these areas and these areas is all different. And so the hair here is very shallow. It doesn't, the hair bulb and the regenerative follicle is not as deep as it is, say, in the back of your head. So because these are so superficial, the laser that removes the tattoo also removes the hair. So you can have scarring from these you'd have scarring from tattoo removal anyway, but you can have scarring from these tattoo removal procedures that actually affect the hair more so than it would in, say, properly done scalp micropigmentation, which is very shallow, but the follicle is very deep. So yes, you can have scarring. And it may interfere with growth of hair that is transplanted to the area. A lot of it has to do with how often things happened, like how often you had to get the tattoo removal procedure, or how often you did microblading and had it fade before doing microblading again or getting the tattoo removed. So if you're somebody for whom this has been kind of a chronic problem, it's happened over several years, you had a lot of different bouts of either microblading or the tattoo removal, then probably it's going to be a little bit more difficult picture. Now, it's not hopeless. I have definitely seen those patients who have been through quite a bit of tattoo removal, of microblading procedures, and we've had a really nice result with their brows, okay? It really just depends on your skin type and how your skin has reacted to this. But don't give up hope. Definitely come in. What your surgeon might do is they might do a couple of test grafts just to see how it grows. 1 or 2 in the brow area, a couple of different places like here, here, and here, because remember, this is different than this is different than this. It's not just that hair is different here and here and here. Hair is different everywhere. It's different at the head of the brow and it's different at the tail of the brow. So you might get some regrowth there. And brow transplantation can be an iterative process. It can be an ongoing, a little bit at a time, addition of more hair to that area to make it look much more natural. So buy into the process, see if it'll work for you. Go to somebody who's an actual expert in brow transplantation with a lot of experience, okay? Because otherwise you're gonna end up with a situation where you've got some transplanted brows that look worse than having nothing there. And take heart. One last thing you could try, and that is a little bit of minoxidil, actually, applied to your brows. Yes, minoxidil is an off-label use. The FDA has not approved minoxidil for brow hair growth, but it might work to get some of that native hair growing a little bit better than it would have originally. So I hope that helps.